Chat, y'all doing all right over there? All right, so we're gonna go ahead and just jump right in. Ain't no need to even play no games with it. So, have you ever had a tooth pain that kind of comes and goes, right? One day it hurts, then the next day you suddenly just feel fine. Then it starts back again, and then you just start just wondering, like, is this really serious? Is this like a real thing? Is it a cavity? Do I need to panic, or can I wait? And you just feel like, man, I don't even know what's going on right now. So today I really want to slow down and just kind of walk you guys through tooth pain, and that way it could actually kind of make sense because I think a lot of times people don't really understand, kind of what's going on with them at the particular time, right? So we're gonna talk about tooth pain, right? So let me go and pull this poll up real quick for y'all. Yeah, there it is, right there. All right, here we go. All right, we there. So let's talk. Let's just talk about it. Let's just jump in right now. So tooth pain that comes and goes when there's no cavity, no pain when you bite. What actually helps you to get relief, and how to know if the pain is an emergency. One day it hurts, the other day it may feel fine, and it's kind of on again, off again, and you don't really know what to do. So because tooth pain can sometimes feel confusing, because sometimes confusion can actually create fear. Fear because you don't necessarily know what's happening, what's going on. So uh, this is probably one of the most common things that people experience with tooth pain, and it usually means something is irritated, but not necessarily destroyed. You got to really think about tooth pain as like a warning sign on your dashboard or something like that. Like it doesn't necessarily mean that your engine is about to explode, but it also means that it's something that you need to really pay attention to. Intermittent tooth pain can sometimes often point to like something like you have early cracks, maybe inflammation, or like some type of pressure or sensitivity. A lot of times when I talk to people, that's kind of one of the top things that they're always talking about. Like they have sensitivity um, on certain teeth. It can mean maybe they got recession, maybe they got maybe a tooth that's cracked, maybe you have some tissue that's receded. What's up, so many Yankees 77? Man, I tell you, the floss probably to use is probably whichever one works, man. A lot of times I talk to patients, it's kind of like a side note, right? I talk to patients and they're on me like, man, I floss like, 15 different, all the time, you know what I mean? But then you can kind of see in there, like, I'm going to let y'all know a secret because y'all on the chat. Um, a lot of times your dentist already knows if you are or not flossing. Plaque usually takes about 72 hours to kind of like really form, like plaque and calculus. It takes a little bit of time to really form. And so, like, even if you brush your teeth, like right before you go to the dentist, some of that soft plaque may be removed, but that calculus, that stuff is gonna still kind of be there. It's gonna hang around. So, you know, just kind of a little nugget for y'all. But back to what I was saying, the nerve, so when you're having that pain, that tooth pain that just kind of comes and goes, it could mean like an early crack. Maybe you got some inflammation with something going on with your gums there. Maybe you could have like pressure issues or even sensitivity. That nerve is actually reacting to something, and the nerve hasn't necessarily given up yet. It's still, kind of alive, but it's still causing you some pain. So now I'm going to just kind of talk to you guys really quickly about tooth pain that you may be having, and there's no cavity or visible cavity that you can see. A lot of times, with my people that asked about the floss, a lot of times cavities happen most commonly in between teeth, or they can happen on your posterior teeth, your back teeth, your molars, right? Those molars have like different peaks and valleys, or grooves, and so sometimes food, debris, sugars kind of fester in those pits, and that's what kind of leads to a lot of the cavities that you may have. So that's really, what I'm saying, what can really kind of throw people off, because they don't necessarily see anything on their teeth. They kind of feel like, you know, everything is good. So, um, excuse me. So not all dental pain comes from cavities. So I'm going to just kind of tell you guys, like, um, if you kind of think about a house, right? You can have electrical problems without actually seeing damage inside of the walls, right? And that's kind of how tooth pain can sometimes feel. Like it's an inside issue. It's something that you can't necessarily see. So maybe the structure of the tooth looks pretty good, but there's something going on internally. And that's kind of why I gave you an example about, electrical problems, because when you're in a home, those problems that that may be behind the walls, you can't necessarily see with your naked eye, but it doesn't necessarily mean that it ain't a problem. So, um, if you have like, cracks, um, they can kind of start like really, really small, right? And those cracks can lead to something, a whole lot worse. But inflammation can be internal. Recession can also expose sensitive areas within your teeth. And then also, too, sometimes there's patients that may be grinding and, kind of overload the teeth. And I got a video coming up that I'm actually going to be kind of talking about that, too. Um, so, so a lot of times, none of this stuff really shows up as a visible cavity, but the nerve still kind of feels what you have going on. So I'm going to just kind of talk to you guys really quickly about, pain when you bite. This is really an important clue because if your tooth hurts when you chew or when you release to bite, that often points to a structural issue. You got to think of like a cracked windshield. When there's no pressure, it looks fine. But once that pressure starts to apply to that particular crack in the windshield, then that's when the crack starts to spread. So you got to really, kind of watch out for that too. A tooth with a crack can feel normal at first, but then you can start to feel a lot of pain when it's under that pressure, like when you're biting and things like that. This kind of pain, often comes and goes, and this is why people, often ignore it. Because if it's not hurting, why even mess with it? So, so let's talk about relief. I don't know what happened right there. It's fine. You can unplug it. Did y'all unplug it? Yeah, it's good. Y'all can talk. It's good. It's live. Like it's not live. Y'all can talk. Yeah, it's cool.
Wait, it's live?
Yeah, I'm live right now.
Huh?
So now let's talk about the relief, right? Because pain makes people desperate. Here's what really helps, like temporarily. So if you have tooth pain, here's what you can kind of do really quickly. You can do like over the counter pain relievers, which actually reduce a lot of the inflammation that you may have with your teeth. Cold packs can also help with like swelling. So if you have swelling around some of your teeth, sometimes that can really help with some type of tooth pain. But sometimes that cold pack can really exacerbate or make that pain feel even worse. So you kind of got to watch out for that too. You really want to avoid. So if you have tooth pain on one side, you want to refer all your chewing to the other side when you're eating. And then you also want to kind of avoid I kind of talked about that with the ice pack. You want to avoid very cold or very hot foods because that cold or hot food can kind of start to affect the nerve, and then you can have a lot of pain with that too. So um, this is the part that people really don't like hearing. Relief doesn't necessarily mean that there's going to be a resolution. So you may take the anti-inflammatory, or you may go in and see um, a dentist or whatever. Like he may give you some antibiotics, she may give you some antibiotics, and the pain starts to go away. But that doesn't necessarily mean that the problem went away, right? So just kind of something to watch on, because I know there's a lot of patients that kind of feel like, oh, it's not hurting no more, so I'm good, and that can really, really, um, kind of affect your long term with the tooth, whether you are able to keep it or lose it. So I want you guys to kind of think about like tooth pain as like once it often means that the nerve is calmed down for the moment. So like when you start doing anti-inflammatory medications, antibiotics, ice packs, so on and so forth, um, you know, it may calm the tooth down, but when you really ignore the recurring pain, it's like silencing a smoke alarm without really checking for the fire. So just kind of be mindful of that. Now let's talk about the big question that I pretty much think everybody on the live is really curious about. So if I have tooth pain, is it really an emergency? So my answer is usually sometimes. Really just depends on what you're having. Are you having swelling? Are you having drainage? Is your face swelling up on one side? Is it becoming like difficult to breathe or swallow? Those are emergencies. Um, if you have a fever, that's another one I got to think about too. So if you're having a fever, that's something too as well that um, you're gonna want to watch out for. Let me start chatting with some people. What's up? What's up, soccer bros? Bothers. Wings VR U7E. What's up? Snowman Yankee 777. Appreciate you being on the call. So tooth pain is more urgent, and so you really gotta watch those. And those signs that I just listed earlier, they really suggest like infection. And that's why waiting can be really, really bad when it comes to making sure that things don't get worse. Tooth pain is less urgent, but it's still important. If it comes and goes, it hurts when you're biting, or you feel sensitive to temperature, the nerve is still vital, and that means that um, you can still salvage the tooth sometimes. Really, you got to look at a radiograph and see what you look like clinically, but sometimes you can still save teeth like that. So an early evaluation can really prevent like other occurrences. So I want to tell y'all a quick story, and then I'm gonna hop off, right? So I had a patient that came and was having pain for about a month or so, and the patient just decided just to keep waiting because it would start up, flare up, and then it would settle down. And by the time he came in, he actually had a crack, and we were able to notice that on the radiograph. And so once we noticed that we had saw that the crack had actually spread it a whole lot further, and the tooth had to actually be taken out. But had this particular patient come in a little bit sooner, it's likely that we would have been able to do something different. But he ended up having to lose that tooth. I hear it a lot. Pain wasn't hurting. It was hurting a little bit, then it went away, and I thought I was good. And then you start to have, depending on what you have going on, sometimes you can have like cavities kind of form and things like that. The tooth pain doesn't necessarily mean that you failed. It doesn't mean that you neglected your teeth and something bad's about to happen. Well, at least not all the time. But that tooth is actually communicating when you have pain. It's communicating that something needs to happen. Just like if you stub your toe or you break an arm or something like that. Those pain, um, that pain signal is kind of letting you know that there's something that you got to do. Pain comes and goes. And you got a short window until that pain, pretty much goes dormant or the tooth becomes necrotic. So you got to really make sure that you jump on this pain before. especially while you're still feeling it, because when you're still feeling it, you still got options. You can do fillings, you can do crowns, you can do other simple treatments. But you know, if it comes and it was really really bad, then it goes away, and it's not so bad, really narrows your choices of what you're gonna do. Either you're gonna get a root canal or you're gonna have to get it taken out. So, you know, my encouragement is just for y'all to go and, you know, get looked at. Make sure that somebody takes a look at you, does a clinical exam as well as taking radiographs, and it's likely that you'll probably be able to really go and get, you know, get something else going. What's up? What's up? All right. So a final thing before I jump off is if your tooth hurts on and off with no visible cavity, or when you bite, just don't ignore it. Don't panic either, but don't ignore what you got going on. Ask questions, get clarity, and protect your options. Pain is not necessarily the enemy, it's actually the information that you need so that you can get help. So when you act on it early, you protect what you got going on, and you have a better peace of mind. Appreciate everybody that's been on the chat. Y'all be blessed. Talk to you real soon.